I think we're about ready to get started, Ricky, if I can pass over to you.
Yeah, absolutely. Thanks, Sam. Okay, hi everyone. Many thanks for joining us. Really excited to be doing this as part of Sheffield Digital Festival. So I'm Ricky Bearfield. I'm a technical architect and I'm also the engineering lead for BJSS in Sheffield. BJSS are an IT and business consultancy who opened an office in Sheffield around 18 months ago. Now, fundamental to the way we work is building strong long-term relationships with our partners, our customers, and using solid engineering principles to help us do that. So I'm going to hand straight over to David now to talk around the background.
Hi, my name is David Gretrix. I work as head of integration development and now architecture over as part of a dedicated team over at Servelec, focused on the delivery of interoperability across a number of care settings, including health and social. I'm here today to talk to you about a solution that we built in partnership with BJSS and also one of our customers. It's called Discharged to Assess. We attended an industry hackathon, sort of pre-COVID, October 2019, and we witnessed a proof of concept demo that was developed by one of our customers. And we were blown away by what the customer had built around our social care system, Mosaic. And it was specifically 3 services: a care data service, which is a FHIR-based standard for sharing structured social care data, which can support systems such as shared care records or health systems for viewing or consuming the data items using FHIR. A referral service, which is a FHIR-based API to enable the full discharge from hospital into social care. It's a huge problem for the NHS in terms of beds being tied up whilst patients wait for referrals into social care to meet their needs. The healthcare locator service, again, which is a FHIR-based API that allows health partners to rapidly and accurately identify the local authority responsible for a patient's social care. And it provides a specific endpoint or technical details needed. Our goal was to build in partnership with BJSS and our customer a scalable version of the first 2 items I mentioned on our interoperability platform, Conexes at Servelec. And this would, in essence, enable social workers to manage the hospital to social care referral process. This traditionally is a very, very manual process. And ultimately, this solution will give a drastic reduction to the number of manual errors and processing overheads. Back over to you, Ricky.
Thank you. Okay, yeah, so as David mentioned, there's lots of benefits in removing some of that manual process by implementing this solution. And obviously, with COVID, the model that the NHS used did shift slightly, moving from assessments taking place in hospitals to assessments taking place in people's homes. And what this solution was able to do is just remove that admin work as people are referred into those hospitals. And in some cases, remove the admin work required to find the correct local authority. That's actually a lot harder than it sounds. And there's, we've looked at specific cases during some of the research we put in, and you can have a couple of houses next to each other where they're in different local authorities or under different jurisdictions for social care, and it's really hard for the hospitals and time consuming. And another even worse sometimes when that work's not done due to that pressure is that it's referred into the wrong social care provider, which then creates redundant work for the local authority. So really very, very important that this project was implemented correctly and in timescales that were set out as well. And we spoke with a couple of different local authorities directly, and I know our product owner spoke to many more, and there was a really clear indication that this had or would have a significant positive effect, reducing workloads.
So working in partnership with BJSS, we ensured that the core requirements were met, delivering an MVP that was within the budget and without a compromise on quality. It's worth noting the budget was significantly lower than the estimated work due to NHS funding constraints. We worked in partnership with BJSS and our customers to find an MVP that kept the customers happy, and also importantly delivered in the very tight timeframes, which was a condition of getting the funding in the first place. We're now in a position where we've delivered to a new national standard within the quarter, from project spin up to deployment on production environments, and all to a very high quality standard. We also push the boundaries on this project. I'm an advocate of behavioural driven development, and as a new team over at Servelec, we were keen to adopt this practice into all of our new developments. Not only did we achieve this, but I'm also quite demanding and looking forward in terms of looking for ways to push the technology forward. And there was a couple of opportunities for us to get reasonable components on our platform, which we were also able to get and deliver. This will have significant benefits to other projects going forward. As you can imagine, building a national system in tight timeframes, knowledge sharing and communication was critical. I found myself having extremely high levels of confidence in delivery and quality documents as outputs.
Yeah, so as David mentioned, that the only output is not the run-in software. That there's being an enterprise development, we definitely need a good level of documentation, and you can see on the slide just an example there of some of the diagrams that are put together. And also the one towards the bottom is the living documentation. David mentioned behavioural driven development, and we use the spec flow and living doc tools to do that on this project, which gives you this lovely output that shows you exactly what the software is intended to do and whether it's currently doing it, and that became really useful actually to the stakeholders of the project and to Servelec's customer as well. Okay, so what about the approach that we took together with Servelec on the project? So it was very much as you'd expect from a modern software delivery. In this case, we were using something that looked a little like Scrum, or quite a bit like Scrum, and included the various feedback cycles that you'd expect and the adaptations in that approach. Also, what's standard in a BJSS approach is applying experience we have from adapting such approaches for enterprise environments. So very much we do have active RAID and technical debt management. We put in place a lean change management process, all to ensure that there's a predictable delivery, and that's something that we went through on calls with stakeholders with David and others. Just to highlight things and talk through exactly where we were, any concerns, and just have a really, really transparent and open relationship. The other thing to note about the way we typically perhaps adapt a Scrum-like process is some of the focus of arranging and prioritizing user stories. We tend to, yes, worry about the things that are going to be most valuable and give us the most return on investment more quickly, but also we worry about the risk. And on enterprise development, it's really important that we tackle risk, both technical and business risk, early in development. So we put a real emphasis on that approach. David.
As mentioned before, we had extremely tight timeframes for delivery. Our funding was ultimately coming from the NHS, and we'd have lost the funding entirely if it hadn't been delivered by the drop dead date. The feedback we got from the delivery team wasn't sugar-coated. We knew exactly where we were, and we worked together in collaboration with our customer to get this delivered. And we had that information at the right time as well, so that if we got that very early on and knew if we needed to put any corrective action in, which was great. The project was delivered in a very agile way, even with the organisation needing complete certainty over delivery. We had the team collaborating direct with our customers, and it worked extremely well. And the BDD test paid dividends, with the outputs being accepted as the sign-off criteria for the funding. Next slide, please, Ricky. We have a really strong relationship with BJSS, and we'll continue to work with them on up and coming projects. Having a mature agile organization really helped bootstrap us from our waterfall past. We'll continue to build on the BDD introduced by BJSS into our agile teams. We've made really significant improvements in the way we manage our projects, growing ourselves from a really small new development team to now a much larger scale, more mature agile teams. Lasting benefits are clear for us, and we've continued to adopt the practices introduced by the team.
Thank you. Okay, so as I said, it's a fairly short presentation today, and thank you to everyone for attending this. If there are any questions, we'll stay around for a couple of minutes. You should be able to ask them via the Q&A. We can stay around for a few minutes to answer them. And if you'd like to find out any more, then please reach out via our respective websites. Thank you very much. Okay, I'm going to say that I think we answered everything, David. Yep. Okay. Well, thanks again, everyone, and we'll say goodbye.